Hello, my name is Jonna Wheeler. My company is Whole Family Health and Nutrition. I am a certified eating psychology coach who specializes in yeast overgrowth, systemic candidiasis, and leaky gut. If you've struggled for years with chronic illness, I bet you've asked the same question I did. You're wondering, how did I get so sick? In this presentation, I will explain the primary and secondary causes of disease and help you find answers for yourself. Hippocrates said, health and disease begins in the gut. So that's our first clue. Since health and disease begins in the gut, it's important to understand how the gut develops. A baby is born with a sterile digestive system. The gut was designed to be populated with several strains of live beneficial bacteria during the process of natural childbirth, and then another different batch of beneficial bacteria through breast milk directly from mom. During birth and afterward, a baby's system is also populated with candida from everywhere. Candida and beneficial bacteria are the two main players in the development of a healthy gut microbiome. Intestinal wall integrity develops as the gut microbiome gets established. The lining of the intestines secretes mucus to create a home for beneficial bacteria who live and work there. The mucus also forms a barrier that keeps pathogenic microbes from penetrating the intestinal wall and going into the bloodstream. Beneficial bacteria live among the villi that line the intestines. They assist in the development and function of the immune system and the digestive system. They convert the food that you eat into something that the bloodstream can absorb. Without them, you cannot assimilate the nutrients you digest. They make nutrients we need for the body to develop and function properly. They make short-chain fatty acids to maintain intestinal wall integrity. They help to defend against pathogens by maintaining the pH to create an environment that is not hospitable to them. Candida have a very useful purpose. Their job is to attack and kill harmful parasites, viruses, and bacteria in the GI tract. This explains why they're so virulent and indomitable, because they have to be tougher than the bad bugs that they were designed to kill. Beneficial bacteria and candida were designed to work in harmony, where they benefit without injuring the host. While the microbiome develops and becomes established, the gut-associated lymphoid tissue, or GALT, G-A-L-T, emerge. Several types of lymphoid tissue form 80% of your immune system, which is in the intestinal wall, to detect and attack pathogens. GALT also becomes tolerant to the food the infant consumes. Peyer's patches are lymphoid nodules that monitor intestinal bacterial populations and prevent the growth of pathogenic bacteria in the intestines. This is how to develop a healthy gut microbiome, which sets up the immune system and how the digestive system gets its start during and immediately after birth. But the immune system and digestive system continue to develop until 2 years of age. I personally have never heard anyone talk about this, but I believe what you are about to hear in the rest of this presentation may be the most important information you ever receive in your life. You may have been predisposed to disease before your mother was conceived, but it has nothing to do with genetics. In 2013, I identified a trend that makes it clear why we are experiencing an increase of disease conditions on such an epidemic scale. In the early part of the 20th century, hospital births increased over home births. There has been a steady rise in cesarean section births since the mid-1960s. According to the data from the National Hospital Discharge Survey, in 1970, only 5% of babies in the United States were delivered by cesarean. Today, 1 in every 3 babies is delivered by cesarean. Until the early 1900s, more than 75% of women were breastfeeding their newborns immediately after birth, and others had a wet nurse. Nestle invented their first formula milk in 1843, and by the beginning of the 20th century, many breastfed infants were also receiving some formula feeding as well. During the early 19th century, wet nursing practices decreased, while the popularity of feeding babies formula mixes based on animal milk rose in popularity. Breastfeeding initiation rates dropped to nearly 50% during the 1920s. Only 25% initiation rates were noted during World War II, 1939 to 1945, because American women entered the workforce in unprecedented numbers to fill the voids in the industrial labor force as a result of widespread male enlistment. During the 1920s and 30s, evaporated milk became widely available and at low prices, and several clinical studies suggested that babies fed evaporated milk formula thrive as well as breastfed babies. But the formula-fed babies exhibited more diet-associated medical problems such as scurvy, rickets, and bacterial infections than exclusively breastfed babies. The availability of the home icebox in the 1930s initiated a tremendous rise in the use of evaporated milk formulas. By the 1950s, over half of all babies in the United States were reared on such formulas. Formula was marketed as superior to breast milk, so breastfeeding rates remained low. In the 1970s, 34% of mothers initiated breastfeeding, and of those, less than half were still breastfeeding at 6 months of age, and only 5% of babies were still being breastfed exclusively at 12 months of age, while at the same time, 62% of breastfed babies started receiving some formula at 3 months, and 84% were getting some formula by 6 months. There was a natural childbirth movement in the 1960s, and a resurgence in breastfeeding coincided with this movement. Mothers have been trying to do the very best for their babies, but their children are not as healthy as they were when they were children. Moms have been functioning without some very important information. For an infant to receive the full complement of beneficial bacteria needed to establish optimal immunity and ensure a long and healthy life, they ideally need to be born vaginally, and the CDC recommends that an infant be breastfed exclusively for at least 1 year, and the World Health Organization recommends breastfeeding until at least 2 years of age. Babies who are exclusively breastfed, meaning not supplemented with formula, have lower rates of respiratory infections, asthma, obesity, type 2 diabetes, childhood leukemia, and atopic dermatitis. They also have decreased risk of sudden infant death syndrome. Studies show that infants who are breastfed longer develop better intelligence and social skills. If a mother has the full complement of beneficial bacteria to transfer to her infant, then vaginal birth and breastfeeding provides her baby with antibodies, but also the beneficial bacteria to establish their immune system to protect against disease, and set up the gut for optimum digestion and assimilation. However, If a mother doesn't have the beneficial bacteria to transfer to her child, the benefits are very minimal at best. What I see in myself and in my clients is that in previous generations of the family, somebody's mother was not breastfed exclusively for long enough, taking beneficial bacteria from breast milk out of the equation. Those who were born cesarean didn't receive beneficial bacteria from the birth canal, so they didn't have the full complement of beneficial bacteria to pass on to succeeding generations. I was born C-section and not breastfed at all, so I got nothing. On the surface, autoimmune disease looks like an inherited genetic thing running through a family, but really it has more to do with the beneficial bacteria they didn't inherit. I hope you can see how cesarean births and formula feeding falls far short of what the body requires to develop full and strong immunity. History reveals how this happened, but the reasons for the rise in C-section births and the decrease in the duration that mothers are breastfeeding is really not the main focus of this chart. What I want you to see is the relationship between the decrease in breastfeeding during the first half of the 20th century and the increase in cesarean births during the second half of the 20th century. The gray line shows the increased rates of yeast overgrowth among the American population, which just happens to coincide with the use of antibiotics and the subsequent increase of autoimmune and degenerative diseases during the past 70 years to epidemic levels. It is critical that we establish a healthy gut microbiome. But if we don't, what does that look like? How do we know if our gut microbiome is not healthy? When conditions in the GI tract are ideal, beneficial microbial colonies compete for the space and resources, keeping Candida populations under control by outnumbering Candida 10 to 1. When beneficial bacteria populations are not adequate, the opportunistic Candida and pathogenic microbes overpopulate. This shows up as diaper rash, psoriasis, infant eczema, colic, and ear infections. Higher levels of estrogen and progesterone during pregnancy encourage yeast colonization as the pH of the vagina changes. Babies born to mothers with vaginal yeast often develop oral thrush within 10 days to 2 weeks from exposure in the birth canal. This can also happen to babies when their mothers are treated with antibiotics at the time of delivery. Oftentimes, mothers are unaware that they were given antibiotics. An ear infection develops, for which the person is given antibiotics. Antibiotics further damage beneficial bacteria populations. Candida create toxins that further weaken the immune system, and the gut lining deteriorates. Antibiotics and steroids cause Candida to mutate into an invasive fungal form that grows through the intestinal wall like the roots of a plant in soil. When Candida penetrates the intestinal wall and invades the body, they become systemic. Systemic candidiasis and leaky gut occur together. Each course of antibiotics encourages Candida to mutate again and dive deeper into the body, advancing yeast overgrowth and its progression through all 5 stages of systemic candidiasis. Antibiotics increase the number of antibiotic-resistant bacteria, which also invade the host through a leaky gut wall, causing illnesses that are extremely difficult to treat. Dysbiosis is microbial imbalance or maladaptation in the intestines. The gut microbiome becomes deranged. The dominating species are diminished and the controlled species increase to fill the void. This is also called small intestinal bacterial overgrowth, or SIBO, or small intestinal fungal overgrowth, SIFO. When intestinal wall integrity fails, it becomes leaky, allowing waste, parasites, viruses, bacteria, chemical pollutants, and food particles into the bloodstream. This is how food allergies, asthma, and chemical sensitivity develop. When intestinal wall integrity fails, it becomes leaky, allowing waste, parasites, viruses, bacteria, chemical pollutants, and food particles into the bloodstream. This is how food allergies, asthma, and chemical sensitivity develop. Candida produce harmful toxins, further weaken other immune system organs, cause organ damage, and disease symptoms emerge. When Candida and its toxins cross the blood-brain barrier, they start causing migraines, brain fog, memory loss, dementia, mood swings, and unprovoked rage. For more information, please watch my video about the 5 stages of systemic candidiasis and leaky gut. Mental health. The microbes in your gut interact with the gut-brain axis, which is the biochemical signaling that takes place between the gastrointestinal tract and your brain. This influences behavior, and I believe this is why children with an unbalanced gut microbiome develop certain central nervous system disorders and behaviors like ADD and ADHD. Beneficial bacteria have enzymes that humans lack for breaking down certain polysaccharides, so without them your body cannot digest some carbohydrates. Undigested carbohydrates in the GI tract then become food for pathogenic microbes, including Candida. This explains the intense cravings for sugar, carbohydrates, or alcohol, because Candida insist upon being fed. The microbiome in your gut influences metabolism, so your inability to stop overeating, binging, or lose weight may have everything to do with the bad microbes in your gut and very little to do with your diet and exercise program. You want your gut microbiome to be working for and not against you, but that depends on which microbes are in control. How disease shows up in your body, whether you get Alzheimer's, MS, or lupus, depends in large part on your lifestyle and diet, which affects the microbes that live in your gut, which then impacts your gene expression. My clients all have systemic candidiasis and leaky gut, but their diseases differ greatly due to their unique life story and biological individuality. Your lifestyle is all the choices you make every day. The food and drink, your environment, chemicals you are exposed to, including medications, stress, and living a fast-paced lifestyle all have a positive or negative impact on your gut immunity. The use of antibiotics began in earnest during the 1940s. Today, a child in America receives an average of 10 courses of antibiotics by the time they reach adulthood. It is important to note that 80% of all antibiotics produced in this country go into livestock intended for our food. So if you are not eating pasture-raised organic meats, you and your child are getting antibiotic and hormone residues in your food. Many things about our food and water supply changed drastically in the 1950s. Chemicals were introduced to our environment, food and beverages. Solvents, pesticide and herbicide residues, food additives, preservatives, heavy metals, and other chemicals are ingested and absorbed from a wide variety of sources in extremely small amounts. But this chemical cocktail is more than the liver can detoxify. No scientific studies on the cumulative effects of toxins has ever been done to determine the harm it is doing to each generation, but I think we can clearly see the results as we observe a world plagued with chronic symptoms and ever-growing disease conditions. Processed, nutritionally devoid food-like substances that contain refined flour, refined sugar, and industrial seed oils do not provide nutrition to the body, feed harmful microorganisms, and destroy health. Chemical additives, mold inhibitors, and preservatives kill beneficial bacteria and increase intestinal permeability, which is leaky gut. This causes the recurrent infection cycle that creates a chain reaction of chronic inflammation and autoimmune diseases. The intestines need to maintain the delicate balance of good and bad bacteria to function properly. When this balance is disturbed by the use of antibiotics, prescription drugs, and/or poor dietary choices, it has cumulative effects on the host's immune health and gradually diminishes their ability to digest food, causing gastrointestinal distress. This predisposes to food sensitivities, allergies, malabsorption, malnutrition, and organ system failure until diseases take hold. Hippocrates said, "Health and disease begins in the gut," and this is what he meant. So what does this look like in a family? My great-grandmothers died at 97 and 101. They were healthy until they died of old age. My father's mother died at 91. I thought, surely I must have inherited the genetics to have a long and healthy life. The answers came when I looked at my family history. My research revealed what happened. My maternal great-grandmother was born vaginally and breastfed exclusively for 2 years. She grew up on the family farm with pure water, organic food, and did not receive antibiotics. She died at 97. She was healthy until the day she died. My grandmother was born vaginally, breastfed for 2 months, and then given formula. Her mother worked, so she was raised in the country by her grandmother. She enjoyed good health until she grew up and moved to the city. She was sick with systemic candidiasis the last 30 years of her life and died at 76, 20 years before her mother. My mother was born vaginally, breastfed, and given formula. This means that though she received beneficial bacteria from being born vaginally, she did not receive the full complement of beneficial bacteria from breastfeeding, because her mother didn't receive it as an infant. She grew up in the 1950s, when chemicals were added to city water. She was given broad-spectrum antibiotics during my C-section birth, which damaged her beneficial bacteria populations, so she had decreased gut immunity. My mother started having health problems in her early 50s. Being born C-section did save my life in the mid-1960s, and I was fed formula because my mother's breast milk never came in. I represent a generation that was profoundly affected by insufficient or absent beneficial bacteria in the gut. I was very sick and almost died of chronic diarrhea and dehydration at 2 weeks of age. The doctors didn't have any answers except to say that I could be reacting to the cow's milk-based formula, but intuition told my 17-year-old mother that something wasn't right in my gut. I was only 2 weeks old. What could possibly go wrong in 2 weeks? My gut didn't receive the beneficial bacteria to develop my immune system and digestive system. Lactobacillus acidophilus produces lactase enzyme, which digests the lactose in milk. Deficiency of this friendly bacteria leads to lactose intolerance and milk allergy. The lack of short-chain fatty acids produced by gut flora can be a cause of diarrhea. So that explains what happened to me. I started having recurrent infections that were treated with antibiotics during my teens and early 20s. If the 4 ectopic pregnancies I had in my 20s had lived, they would not have received any beneficial bacteria from me, even if they were born vaginally and breastfed, because I had none. However, they would have received a full complement of every kind of Candida yeast, and my children would have been very sick very early. I was diagnosed with final stage systemic candidiasis, leaky gut, and breast cancer at age 32. No one in my family ever had cancer before. My children would be in their mid-20s now, and my grandchildren would have even worse health. This is the trend I am seeing, and it explains why we are experiencing a slow progression of seemingly indeterminate symptoms. 95% of patients with autoimmune diseases were labeled hypochondriacs in early stages of their disease. 80% of autoimmune disease sufferers are women. They are told nothing is wrong with them for years as their symptoms develop into the onset of a wide range of life-altering chronic diseases. Years of their life slip away before receiving any kind of diagnosis and treatment, leaving them feeling abandoned and confused. By the time tests reveal any answers, they have progressed into debilitating autoimmune diseases. Autoimmune diseases have been on the rise for the past 7 decades in industrialized countries around the world. This is not because more physicians are aware of it, but rather because of a genuine increase in the number of people who are falling ill. Epidemiological studies are aware that something is driving these numbers upwards. It's more than a change in environmental factors, like exposure to toxins. What the people of industrialized countries have in common is access to alternatives like C-section births and infant formulas. It is no coincidence that the Amish in America have much lower incidence of autoimmune diseases because they have been giving birth naturally and breastfeeding their babies exclusively until they are toddlers. Also, they don't get vaccinated or take pharmaceutical drugs. Symptoms are the language of the body communicating to you that there is a problem, and it is pointing to the problem. Symptoms are not the problem. Medications don't correct the problem. Instead, they subdue the body's efforts to communicate a serious need or problem. And basically, medication tells the body to shut up. 70% of Americans take prescription drugs. The average number of prescription drugs per person annually in 1993 was 7. Today, doctors write an average of 13 prescriptions for each man, woman, and child. That's about 1 new prescription every month. 13% of the overall population take antidepressants, and most of them are women. 100,000 Americans die each year from prescription drugs. Medication is big business, and the pharmaceutical industry wants lifetime customers. Our children are consuming the lowest quality food, experiencing poorer health, and taking medications before they ever leave the womb. What will happen if this continues? Systemic candidiasis and leaky gut is the beginning of disease. You have to get systemic candidiasis and leaky gut before you can get any chronic symptoms, illness, or autoimmune disease, including cancer. When you focus your efforts on the cause of disease and give your body what it needs to heal, instead of medicating symptoms, it has a miraculous ability to reverse disease. You may have been born vaginally and breastfed, but if your mom didn't have any beneficial bacteria to pass on to you when you were born, because she didn't receive them as an infant or she was given antibiotics in the past, then you end up in the same situation as those who were born C-section and fed formula. Also, that means you have nothing to give to your children to pass on to their children. You can't go back into your mother's womb and have a do-over, or go back to the generations before you and fix the past. But you can turn this around for yourself and your children so their children and future generations have the best chance of a long and healthy life. To reverse disease, it is important to restore Candida to its original form, function, and station, and heal the intestinal epithelium. If it was easy to do, you and many other people would have already accomplished it. This is my specialty and something I am really very passionate about. My purpose and passion is to help you navigate on your journey through illness to wellness, so you can avoid the time-consuming, costly detours and dead ends, and start living the life you were meant to live sooner. I want my clients to get to a point where they don't need me anymore, so I can help more people and not just the same people. I want to be for you the person I wish I'd met when I was chronically ill, searching for answers and solutions to my rapidly deteriorating health, and running out of energy, time, money, and hope. You need someone who will listen and understand what you're going through. I'm here for you. I've created several educational resources for you. If you visit my website and go to the blogs, you will see I have written articles about health, nutrition, and emotions. There's also recipes. I'd encourage you to watch all of my videos. The next one I would suggest that you see is the 5 stages of systemic candidiasis and leaky gut, because they occur together and predispose the body to chronic illness and autoimmune disease. I want you to know what you're dealing with. After that, I would recommend that you watch Why is Candida so difficult to eradicate? You need to know your enemy to defeat them. If this information resonates with you and you want to reach out to me, please send me an email to schedule your free 30-minute introductory consultation. I look forward to serving you. Thank you for watching my video. I wish you optimal health, safe travels, and many blessings.